The coronary sinus view is a very important view. Even though we do not see the left ventricle or the entire left ventricle, only the basal portions of the left ventricle, we have a way of looking at the basal septum and to assess regional wall motion abnormalities here. Furthermore, we only see the basal portions of the right ventricle, but we do see the coronary sinus, and thereby we can look at pathologies which are located or which affect the coronary sinus. This is an example of a still frame of such a coronary sinus view. The coronary sinus is visible here. Those are the basal portions of the right ventricle with the trabeculations visible, and this is the basal inferior septum. What pathologies can be studied? For example, persistent vena cava superior, very nicely visible here, the dilated coronary sinus and the contrast which enters the right atrium. We'll be talking about that pathology later when we talk about congenital disease. Dilated coronary sinus are also seen, for example, in the presence of elevated right atrial pressure, and in cases where patients have a pacemaker lead in CRT patients, we can also see those leads within the coronary sinus. So the coronary sinus does have an importance in various clinical situations, and with this view we can visualize the coronary sinus.